Globally, NCDs kill about 41 million people annually, with 80% from low and middle-income countries, including Uganda. In Uganda, 3 over 10 people die due to NCDs. The main NCDs are cardiovascular diseases, diabetes, cancer, and chronic respiratory diseases, with risk factors being tobacco smoking, lack of physical exercise, excessive consumption of alcohol, unhealthy diets, among others. More efforts have been done by government with partners such as UNCDA to address the issue of NCDs, like having awareness campaigns, regular screening, physical activity, and community empowerment. Uganda NCD Alliance was founded to respond to the non-communicable disease challenges in Uganda with the vision of a society free from preventable NCDs and mission of leading civil society response against non-communicable diseases by placing people's health at the center of the national agenda through advocacy, empowering and inspiring the population.
We know the preference and the government can plan, so there can be appropriate planning when we know what we are planning for. I've also said there should be nutrition as proper diet sensitization, especially before adding diabetes.
Uganda Non-Communicable Diseases Alliance aims at preventing and controlling cancer, diabetes, cardiovascular diseases, and other non-communicable diseases through capacity building and resource mobilization and community empowerment. Uganda NCD Alliance normally carries out a large-scale awareness campaign using mass media, community and health facility-based outreaches, publicizing to raise awareness on NCD's risk factors and stigma, and promote early, continuous and regular health screening.
bategere endwaire dino diriyo endwaire da sukali pressure endwaire ya kansa abandi babanado baloza ngati buloge baada agabajja kubayiga naba habona baida babawuzisa muntu yade yakuwa dozi muntu yaloza ati bwana amire ebyo adakuba akoze amazu.
UNCDA always takes part in different activities that fight the causes of non-communicable diseases, such as fight against tobacco use and its effects. The Alliance joins the Ministry of Health every 31st day of May to mark the World No Tobacco Day, being guided by the World Health Organization themes. The link between tobacco and cardiovascular diseases has long been widely unknown. Hence, cardiovascular diseases account for highest number of non-communicable diseases, with 18.6 million people dying annually. UNCDA commemorates other World Health Organization health days like World Heart Day, World Cancer Day, World Diabetes Day, World Stroke Day, among others. Activities to mark these global health days are rolled out to districts and communities, just like the anti-tobacco campaign in partnership with district health offices in 10 districts. The leadership are always engaged. Activities marking Global Health Days include NCDs screening or testing for mainly NCDs like cardiovascular diseases, cancer, and diabetes are always carried out. UNCDA always carries out a random blood sugar test, blood pressure checks, cervical cancer, breast examination, and prostate checks. Uganda NCD Alliance inaugurated aerobics club aimed at promoting physical activity in the district with support of District Health Office and volunteers from various organizations working in Kasese district. People living with NCDs in Uganda have testified on how Uganda NCD Alliance has helped them to manage living with such diseases.
She has said just her name, that she started knowing what her condition took her brain.
When I feel very weak and all the time good for urine. I hear like one to donc jam bena yera ka jam kana bena winning come mete.
Yeah, she had a problem with the urine, constant urination, and then there are certain foodstuffs whenever she could eat she wouldn't feel comfortable and was feeling trouble. And she had to go to the hospital. From there they started doing a lot of tests and medical examination. Then from that time they also told her that she is diabetic.
In districts where Uganda NCD Alliance operates, local communities exhibit high demand of NCD screening services, yet health facilities are overburdened. A survey study conducted by the Alliance in 10 districts indicated that 50% of health workers in health centers 3s and 4s cannot diagnose or treat non-communicable diseases.
We don't have special doctors who handle hypertension and diabetes or health workers, but those very ones are the ones who offer.
But according to your analysis, do they have the right knowledge to look after these people? Or do they have the skills? Do they undergo any training?
They have the skills, but you know when you're handling so many things, sometimes you can lose focus. But if you have like a clinic there and you know that there's a clinic there for hypertension, people who will be put there will be having much focus to handle hypertension and diabetes.
The survey further found out that 67% of health workers, other than lacking necessary knowledge and skills, lack access to basic screening equipment. Health centers lacked basic equipment to screen people with NCDs such as blood pressure machines, weighing scales, stethoscopes, and glucometers that measure blood glucose levels. However, Uganda NCD Alliance, together with district health officers, select health facilities, mainly Health Center 3 and 4, to offer them free screening services. However, there is need for government to have enough health workers, give them skills to enable them to detect and refer people with NCDs, and also continue with sensitization.
From government is to support the facility. Like if you organize these people in the like clinics And when we get the real number of people, because as we organize them as it's a clinic, we will get more people will be coming. Now, the number of people will increase. And included the system has to now really increase on their staffing level. There's also to people who are working there to have some trainings.
Uganda NCD Alliance also every year takes part in the World Cancer Day, sensitizing Ugandans about risk factors that lead to cancer and educating them about preventive measures, and World Diabetes Day through awareness campaign in different roundabouts entering Kampala like Mulago, Ginger Road and Garden City, among others. The Alliance also has been participating in other activities like National Physical Activity Day in Kololo, which takes place every year. Uganda NCD Alliance participated in the World Obesity Day 2021, creating awareness that obesity is also a major risk factor for various NCDs and other chronic conditions.
Globally, the prevalence of obesity is increasing, especially among young people. And even in Uganda, as the socioeconomic status improves, now obesity is also increasing, especially among the affluent populations within the country. So we are fighting obesity, and the only way we can fight obesity, number one, is to be physically active or to do exercises. Number two is to eat healthy, to eat a lot of vegetables, fruits, and minimize carbohydrates and fats, so that you can remain healthy and beat non-communicable diseases.
It is caused by eating fatty foods, sugary foods, not exercising, and frequent eating all the time, and it's not good. Then you can prevent it by doing physical exercises, reducing fats in the body.
You can as well avoid sitting for a long time. You can avoid those other things that do not make your body active.
When COVID-19 pandemic hit Uganda in March 2020, people living with non-communicable diseases, NCDs, such as hypertension, cancer, diabetes, and chronic respiratory diseases were more vulnerable and continue to be vulnerable in catching the virus and dying. In mid-March, when the country went into total lockdown, the delivery of many essential health services was disrupted. The NCD clinics at national and regional hospitals were closed to prevent the spread of coronavirus. This led to hundreds of people missing out on their drugs and routine medical checkups. In August 2020, the Ministry of Health issued a circular to health service heads and providers at all levels, offering conditional guidance on the continuity of essential health services with a specific focus on addressing the critical needs for patients with NCDs. Among the guidelines offered was the need to ensure that NCD screening is fully integrated into the triage. Experts also say that to address the continuous infections of NCDs, government should impose high taxes on sugary drinks, alcohol, and tobacco, which are leading causes of NCDs, of cancer, hypertension, and diabetes. A lot needs to be done in Uganda to combat non-communicable diseases, and continuous levels of awareness are also wanting in regards to non-communicable diseases and leading causes of these diseases.
The government should review the budget for primary health care in as far as funding for essential medicines is concerned. Because the budget, like a facility like health center for here, which is given an allocation of about 11 million per cycle, that's no money.